So, questions. Periodontal disease most nearly fulfills Koch's postulates. The one that most nearly fulfills the postulates of Koch is local aggressive periodontitis, because the Koch's postulates say that a pathogenic bacteria causes diseases. The disease is transmittable through the bacteria, and if you eliminate or control the bacteria, you eliminate the infection. So, if you eliminate the actinomyces, actinomyces concomitants, which cause localized aggressive periodontitis, and the Porphyromonas gingivalis, then you get rid of the localized aggressive periodontitis. And this is what Koch's postulates say. Fremitus is a palpable pathologic occlusion bite typically found on one upper front tooth when a patient closes their teeth. This tooth vibration is considered an occlusal trauma. Signs and symptoms of a non-physiologic occlusion include damaged teeth and restorations, abnormal mobility, fremitus, widened PDL, and possibly pain. So fremitus, palpable pathologic occlusion bite. Which teeth are most frequently involved in root amputation? Maxillary first and second molars. The maxillary first molar is the most frequently involved in root amputation. A root amputation and hemisection must be done in conjunction with endodontic therapy of a particular tooth. Endodontic therapy is performed first, followed by periodontal therapy. Root amputations, the separations of an individual root from the crown. Most root amputations involve maxillary first and second molars, commonly involved periodontal sites. Okay, that's why they are very commonly amputated, because these are very common periodontal sites. Burrs and diamonds stones are used to sever the crown and root before extracting by root tip forceps. Once the root amputation is complete, the remaining apical area of the root of the crown Once the root amputation is complete, the remaining apical area of the crown and furcation region are recontoured similar to the shape of a pontic, so maximal access is provided for oral hygiene. Now, a hemisection is a vertical sectioning of the tooth through both the crown and tooth and root. Usually, a hemisection is used in a mandibular molar region, where the crown is divided through a bifurcation region. 50% of the tooth is extracted if one specific root has excessive loss of osseous support, and the remaining half of the molar tooth is now treated as a premolar. Next, which Miller defect responds best to mucogingival surgery? Remember that Miller defects are a classification proposed system for recession that has influence on the success of the surgical procedure. A class 1 is a recession that doesn't extend to the mucogingival junction. There is no loss of interdental bone or soft tissue. A class 2 is a recession that extends to or beyond the mucogingival junction. There is no loss of interdental bone or soft tissue. Class 3, there is a recession that extends to or beyond the mucogingival junction. Loss of interdental bone or soft tissue that is coronal to apical extent on the marginal tissue recession. And class 4, which is recession to or beyond the mucogingival junction. Loss of interdental tissue to a level apical to the recession. Complete root coverage can be achieved in class 1 and 2 defects, with only partial coverage possible in class 3. However, class 4 defects cannot be successfully treated. So the answer is number 1 and 2. Which Miller defect responds best? Class 1 and 2. Responds best to mucogingival surgery. Class 1 and 2. So osseointegration. The concept of osseointegration is number 6. Osseointegration is direct attachment to inert alloplastic material without intervening with connective tissue. Direct contact between bone and implant surface. Implants have a peri-implant soft tissue seal where junctional epithelium attaches to the implant surface by hemidesmosomes. So junctional epithelium attaches to implant surface by hemidesmosomes. 7. Bacteria associated with implants, this will be with peri-implantitis. Bacteria associated with peri-implantitis. A healthy sulci around dental implants are characterized by a predominance of coccoid aerobic species with a low number of gram-negative anaerobic species. In contrast, the pockets associated with peri-implantitis are colonized by high proportions of anaerobic gram-negative rods, motile organism spirochetes. So again, peri-implantitis have a high proportion of anaerobic gram-negative rods, motile microorganisms, and spirochetes. They also may be colonized by Pseudomonas aeruginosa, Candida albicans, and staph species. 8. Surgical technique for ridge augmentation. Surgical technique for ridge augmentation. Bovine bone is most commonly used for oral bone grafting applications, including ridge augmentation and maxillary sinus augmentation or lifts. 9. Inverse bevel incision. So it is also known as reverse bevel flap. It is an apically displaced flap. It's modified Whitman flap. And inverse bevel incision. Horizontal incisions for full thickness flaps. There's 3 horizontal incisions are usually associated with full thickness flaps. The first is the internal bevel incision, depending on the goal. Okay, anyway, it can either be 0.5 to 1 millimeter from the free gingival margin. It is also known as reverse bevel incision, which is inverse bevel incision is also known as reverse bevel incision. This removes the pocket lining, conserves the outer dimension of gingiva, and produces a thin, sharp, flat margin that can be adapted to the bone-tooth junction. Question number 10. Inflammatory mediators may be indicator of disease activity. Inflammatory mediators that can be indication of the disease activity. It's an interleukins 1 and 6. Interleukin 1 and 6. Also tissue necrosis factors, or all. Well, I guess it was all of them. Interleukin 1 and 6, and tissue necrosis factors, so all of them. 11. Which enzyme and cytokine is secreted by a macrophage? Which enzyme and cytokine is secreted by a macrophage? Cytokines are important signaling molecules released from cells. The cytokine interleukin 1 is important in bone resorption. Interleukin 8, inflammatory cells, attract inflammatory cells. And tumor necrosis factor is important in activating macrophages. So tumor necrosis factor activates macrophages. TNF, macrophages. Cytokine, TNF, activates macrophages. Allograft has following characteristics except a, anyway, let's see, allograft has different characteristics except that is osteoinductive. Allografts are not osteoinductive. What is an osteo? Let's see. Okay. Allograft have all the following except osteoinductive. Allografts, these allografts are graft material that is obtained from cadaver bone that is processed to ensure sterility and to decrease substances in the bone that can trigger host immune responses. However, this process destroys the osteoinductive capability of the bone. Okay, allograft is obtained from cadaver and is processed to sterilize and decrease the substances in bone. This process destroys the osteoinductive capability. They do keep the osteoconductive property of the bone. Although allograft avoids the need for a second surgical site, a greater amount of graded material is resorbed compared with allografts. Allograft materials include undecalcified freezed bone allograft, which is osteoconductive material, and decalcified freeze-dried bone allograft. So, osteogenic material owing the presence of bone morphogenic proteins that are exposed during the normalization process. This is an allograft, okay? So allografts are not osteoinductive. They are osteoconductive, osteogenic, and they can be demineralized. Only autografts are osteoinductive. In the process where they treat the allograft, they'll take the factors that would allow it to be osteoinductive. So they are not osteoinductive. They just hold the space for conduction, osteoconductive. 13. Typical dose of nitroglycerin. Nitrostat is a tablet, 0.3 milligrams, 0.4, or 0.6. 14, which is not a feature of primary resistance from an amalgam preparation. Which one is not a feature? Minimum film thickness is the important property of zinc phosphate. Zinc phosphate should be mixed in incremental additions every 15 to 20 seconds in figure of 8, ensuring saturation of the powder with the liquid adds strength to the cement. Frozen slab technique is used to cool off the exothermic reaction. 16. The asbestos liner is used in casting ring to permit extension of the mold. A layer of asbestos Asbestos used to line a dental casting ring so that during the heating and expansion of the investment, the compression of the liner will free the investment from will free uh, the investment from the restraining of the ring. Again, layer of asbestos used to line a dental casting ring so that during the heating and expansion of the investment, the compression of the liner will free the investment from the restraining of the ring. What is a ferrule effect? Ferrule effect increase resistance to fracture. A ferrule, when a crown is needed, the axial walls of the crown engage the axial walls of the prepared tooth, forming the ferrule. The ferrule is a band that encircles the external dimension of the residual tooth, similar to the metal bands around the barrel. It is formed by uh, the walls and margins of the crown. A longer ferrule increases resistance to fracture. Fracture resistance to cervical tensile strength increases significantly with an increasing amount of sound tooth structure. Again, fracture resistance increases significantly with an increasing amount of sound tooth structure. A longer ferrule increases fracture resistance and resists lateral forces from post and leverage from the crown in function. And a crown preparation with 1 mm coronal extension of dentin above the margin have double the fracture resistance compared with when the core terminates immediately above the margin. The ferrule must encircle a vertical wall of sound tooth structure above the margin and must not terminate on distorted core material. Insufficient remaining tooth structure to construct a ferrule should be evaluated for crown lengthening um, or orthodontic extrusion to gain access to additional root surface. Next, gingivectomy. Gingivectomy is a surgical procedure that reduces pocket depth by resecting the tissue coronal to the pocket base. The final aspect of the gingivectomy is to bevel or contour the wound's coronal margin to provide the most physiological shape and marginal thickness so adequate oral hygiene techniques can be performed. What is the chemical used to test lethality? Ethyl oxide.
Ethyl.
Ethyl oxide. Ethyl oxide. No, ethyl oxide. Ethyl chloride. What is the chemical used for testing lethality? Ethyl chloride. Ethyl chloride. Cold testing can be done with cold water, sticks of ice, ethyl chloride, which is -5 Celsius, and dichlorofluoromethane, which is Indo ice, dichlorofluoromethane. Ethyl chloride then is the chemical used to test lethality. In the ethyl chloride or Indo ice method, ethyl chloride is sprayed liberally onto a cotton pallet and then applied to the tooth surface. 20. Conservative treatment of hypersensitive erosion areas. What do you do in a conservative treatment for a hypersensitive erosion area? Applied sodium fluoride paste. What is the mechanism of action of meprobamate? Meprobamate binds to GABA receptors, which interrupt neuronal communication in the reticular formation and spinal cord, causing sedation and altered perception of pain. So, mechanism of action of meprobamate is binding to GABA receptors that interrupt communication of reticular formation and spinal cord, causing sedation and altered perception of pain. 22. Metal ceramic restoration may fail due to fracture of ceramic material. This can be avoided by having adequate thickness of metal framework and having the proper tooth reduction. Again, metal ceramic restoration may fail due to fracture of ceramic material, and this can be avoided by making a metal framework that is adequate on thickness and by doing a proper tooth reduction. Metal ceramic fractures, we're talking about this question. Metal ceramic fractures, modes of failure in metal ceramic restoration. There's adhesive failure modes, there's cohesive failures, and let's see. A mode of failure in metal ceramic restorations, adhesive failures, and this means that porcelain metal interface, there is no formation of oxide in the porcelain metal interface. That lack of oxide formation makes the porcelain metal interface to fail. There's oxide metal interface contamination. This is due to contamination of metal. So there's two different modes of failure: adhesive and cohesive. In adhesive, it can be a failure in the porcelain metal interface because the oxide was not formed, or it can be also the oxide metal interface when there's a contamination of metal that causes the adhesive failure problems, and there can be also a porcelain oxide interface when there's a contamination of oxide surface. This is all part of the reasons of adhesive failure mode. And in the cohesive, porcelain inclusions or voids, and this is the preferred type of failure. This is out of all of them, the least problematic. And also there can be an oxide to oxide layer that is too thick. There can also be a metal to metal problem in which is not clinically relevant and never really happens. Fracture of a porcelain fused to metal restoration can usually be attributed to inadequate framework design. Inadequate framework design. Okay. Next question. Inflamed capillary hemangioma of oral cavity microscopically resembles a pyogenic granuloma. So, inflamed capillary hemangioma of oral cavity microscopically resembles pyogenic granuloma. pyogenic granuloma. Okay, inflamed capillary hemangioma. Microscopically resembles a pyogenic granuloma. A pyogenic granuloma is a hyperplasia of capillaries and fibroblasts. So it does resemble a capillary hemangioma. Capillary hemangioma resembles a pyogenic granuloma because pyogenic granuloma has hyperplasia of capillaries and fibroblasts, which is very similar to capillary hemangiomas. Next, pellicle formation involves which of the following? Pellicle formation involves which of the following? Pellicle formation, selective absorption of acidic glycoprotein from human saliva. Selective absorption of acidic glycoprotein from human saliva. That's what pellicle formation involves. Pellicle formation involves which of the following? It's a selective absorption of acidic glycoprotein from human saliva. Pellicle, as a we read that is a glycoprotein deposit derived from salivary constituents that rapidly covers and is selectively absorbed onto a freshly cleaned tooth surface. Pellicle formation is the first step in plaque formation. Next, what kind of response do recently erupted permanent teeth usually give to pulp test? What kind of response do recently erupted permanent teeth usually give? They give a very unreliable response. Okay? And we read here in dental text that what are the causes of false readings? They're both false positive responses and false negative responses. One of the false negative responses is that the tooth has recently erupted and has an immature apex. So testing for a tooth vitality can be very unreliable. Okay? Other causes of false readings on pulp testing, if it's false positive responses, it can be because the electrode or conductor contact with metal restoration of the gingiva, patient anxiety, liquefaction necrosis may conduct current to the attachment apparatus and cause a false positive response. Also, a false positive response can be caused by a failure to isolate and dry the teeth before testing. And remember also electrode or conductor contact with, they make contact with a metal restoration or gingiva. So these are false positive responses. Now, false negative responses, partial necrosis is a false negative because it tells you a negative response but it's false. Also, recently erupted tooth with an immature apex. Excessive calcification of the canal can also give you a false negative. And false negative means that everything's fine, but Um, no, false negative is that it tells you, the exam tells you that there's something wrong, but there really isn't. A recently traumatized tooth, inadequate contact between the electrode or conductor and the enamel. The patient has been heavily premedicated with analgesics, narcotics, alcohol, or tranquilizers. These all will give you false negative responses. Next, an asymptomatic sinus tract is adjacent to the mesiofacial root of tooth. Again, an asymptomatic sinus tract is adjacent to the mesiofacial root of a tooth. The probable diagnosis is suppurative apical periodontitis.
Suppurative.
Suppurative
Apical.
suppurative apical periodontitis. An asymptomatic sinus tract is adjacent to a mesiofacial root of a tooth. Probable diagnosis is suppurative apical periodontitis. Suppurative apical periodontitis, also known as chronic apical abscess, or actually it is a chronic apical abscess. Chronic apical abscess. Continuously or intermittently draining sinus tract usually drains into the oral mucosa. The next question. In a radiograph, ground glass appearance, loss of trabecular pattern, and complete loss of lamina dura. What is the diagnosis? Fibrous dysplasia. Ground glass. Ground glass. Fibrous dysplasia, like what Catherine Aguiluz had. Fibrous dysplasia. Fibrous dysplasia is a symptomatic alteration of bone, which is a swelling mass upon occurs. Normal bone is replaced by a fibrous tissue and non-functional bony trabeculae. Teeth may look like they are moving or displaced due to bone-growing tissue. Panorex shows typical ground glass bony appearance. Thus, ground glass is seen. Perform additional diagnosis tests like skull radiography and blood chemistries to confirm the diagnosis. Let's read about burning tongue syndrome. Burning tongue syndrome. Patients usually do not exhibit clinically detectable lesions, but symptoms of intense pain and burning. Burning tongue syndrome is frustrating for the patient and clinician because there is usually no clean-cut cause and no uniformly successful treatment. Typically affects middle-aged females. It affects men too, but usually at an older age, and rarely in children and teenagers. The possible etiologic factors can be anemias, either pernicious anemia or iron deficiency anemia, diabetes, gastric disturbances, psychogenic factors like emotional conflicts and cancerophobia, trigeminal neuralgia, microorganisms, xerostomia associated with Sjogren's syndrome, anxiety and drugs, local irritations like tobacco and spices like cinnamon, and vitamin deficiency, especially vitamin B complex. Next question, 30. Developing tooth bud is damaged so that the tooth erupts with defective enamel. The condition is So apparently, a damage to the tooth bud can uh, cause different things, from dilaceration of the roots to obliteration of the canal. Um, but what we have, what we have on the um, okay. We'll see next question because I couldn't find anything. A cyalolith. Cyaloliths um, are salivary calculus or stones. So cyaloliths in Wharton's duct, which is a submandibular duct, are often found with occlusal radiographs. Calculus deposition in the salivary ducts and glands is more common in middle age. The most common symptoms of duct obstruction are an increase and decrease in swelling in the gland, especially at mealtime. The swelling may or may not be painful, but may also occur in children. Transillumination of the soft tissue is useful to detect cyalolithiasis in children. Rate of occurrence in the submandibular gland and duct is much higher than in the parotid ends or sublingual. So submandibular gland is much higher than sublingual or parotid due to the submandibular salivary tendency and long irregular duct shape. The treatment is surgical extirpation of the cyalolith. Salivary stones located in the glandular parenchyma also usually require surgical removal of the gland. 32. A common gutta percha solvent is chloroform. Common solvents used to soften gutta percha are chloroform, methylchloroformate, halothane, rectified white turpentine, and eucalyptol. So chloroform. When the free margin of the gingiva is enlarged as a result of inflammation, its crest moves. Okay, when there is a um, when the free margin of the gingiva is enlarged as a result of inflammation, its crest moves occlusally. When the free margin of the gingiva is enlarged as a result of inflammation, its crest moves occlusally. 34. Trauma from occlusion is least likely to affect which of the following? Answer: epithelial attachment. It can damage, trauma from occlusion can damage cementum, enamel, PDL, except epithelial attachment because it's not fused, it is mobile. The next question. Trauma from occlusion is likely, okay, is least likely to affect which of the following epithelial attachment. 35. The least common cyst in the oral cavity is a dermoid cyst. A dermoid cyst is relatively uncommon in the oral cavity. This cyst frequently contains hair, sebaceous, and sweat glands, dermoid cyst, as well as tooth structures. The most common site is the midline of the floor of the mouth, if above the mylohyoid muscle. It appears as a mass in the upper neck, if below the mylohyoid muscle. The treatment is surgical removal of the entire tumor. So dermoid cyst is the least common cyst in the oral cavity. 36. Selective grinding for equilibrating complete dentures is best accomplished after processing when the dentures are rearticulated using original jaw relation record, rearticulated when using new jaw relation record, or equilibrated in the patient's mouth. We'll have to study more about that. Okay, this has been 36 questions.